And we're live. Welcome to the Eat Well Move Well radio show. Welcome to the Straight Talk Mind and Muscle podcast. Dr. Kirk Parsley, welcome back again. I think it might be your fourth time on the show.
Wow, man, I didn't realize there'd been that many times. I'm kind of expecting a ring now. I mean,
man, it's cool to interview some cool people and to be able to get people back is a big deal for me. I'm going to paint the picture for people that are listening that haven't heard you on the show before. You know,
yep.
Kirk, you're a former this is interesting actually. High school dropout, moved on to become a Navy SEAL. So now you're a former Navy SEAL. You moved out of the SEALs to become a doctor. You went back to the Navy as their medical doctor and worked with the SEALs in particular. You developed a I call it a special forces sleep remedy, or you've got the Navy SEAL sleep remedy there that helps, you know, all those guys get off those sleep drugs and all those bad things that occurred to mess up their sleep and hormones. You're a former war fighter and you're a current, I'd say, a specialist or expert medical doctor. I really want to get you on the show and talk about the current state of affairs with COVID-19 from a medical side and the government mandates. I won't say medical mandates, but the government mandates around COVID-19 vaccination measures and what they're putting on the population. So, man, I know I'm dropping a few grenades here, and you really are one of the best people to speak to for this, a warfighter, a medical doctor.
Yeah.
The reason I chose you, man, is 9 months ago, we had a great podcast around sleep and hormones. I think it was called The Hormone Secret. But before we started, you said, hey, you know, I'm looking at all the research here around COVID-19, and these esteemed medical bodies are saying this, and these esteemed medical bodies are saying this. And you, as an expert, and dude, you're one of the smartest guys I know, you couldn't discern. So what are we supposed to do, man? I mean, where are we at now?
Yeah. Well, you know, when COVID first started, I mean, you have to give everybody the benefit of the doubt. When COVID first started, there was a lot of unknowns. It could have been some horrific plague, and perhaps they could have made some difference had they played their cards right and did certain interventions in a certain way. But at this point in the game, you know, I mean, we're so far into this. You just have to be honest that there's no evidence that anything that we've done has made any difference, other than the vaccine. So the vaccine has decoupled death and severe disease for the high risk, for those at high risk, right? So if you have a lot of comorbidities, or if you're elderly, which by definition is a lot of comorbidities, it's kind of the same thing. That's kind of what old means. You know, then it's reasonable for you to get the vaccine, you know, because there's something like a 5% death risk, like over 75 or 80 or something like that. I think it's over 80. So if you're over 80, like, yeah, 5% is a pretty big deal. Now, does that mean that there's no risk if you get the vaccine? No. I mean, you could still die from COVID if you get the vaccine, and you could die from the vaccine probably. You know, that's one of the things that they're not being forthcoming with is the results of the safety. You know, the safety data for vaccines. You know, I tell people all the time, it doesn't take a long time to develop a vaccine. The reason it takes a long time to get a vaccine to the market is because it takes a long time to establish safety. Yeah. Many, many years to establish safety, because you're messing with the most robust system in our body, right? The immune system is essentially everything. Right? Every organ, every tissue in your body has a component of the immune system in it, and it's infinitely complex, right? I mean, it's not just T cells, B cells, and antibodies, right? I mean, there's all sorts of interferons and interleukins. Like there's all these chemical signaling molecules. There's all these different types of white blood cells that are involved. There's different epigenetic shifts that can change the way that the immune system's working. I mean, it's an infinitely complex thing. Nobody understands it completely. So, when we get into when we get into something like a vaccine, all that we're really doing, we're giving a partial infection to give a partial protection, and that can have some by definition, we want that to have long-term effect on the immune system, right? Like we don't want it to just last a week or two. We want it to last years, ideally, right? Like polio vaccine, you take that when you're a kid and that's it. And you want that to last the rest of your life. So what does that mean? That means I've altered my immune system for the rest of my life.
Yeah.
So if I'm taking something that's going to alter my immune system for the rest of my life, probably need more than 6 months of safety data to know if it's going to be safe, right?
Now, can I pause you there? And it's along the same lines. Again, for the audience, you're a former special forces guy, so am I. I got vaccinated with everything known to man.
Yeah,
but I got vaccinated with vaccines that have that long-term safety.
Yeah, except anthrax, probably, right? Like you probably got anthrax, and
you guys got anthrax because of golf. But I didn't. My person didn't get anthrax. The worst one I got was Japanese encephalitis virus, which has a 1 in 1,000 adverse event.
Okay. Yeah. So I tell people all the time, like I'm definitely not anti-vax. I mean, the way America is working right now is, the left controls all the language and narratives. And so they change the definition of words to mean what they want them to mean. So by their definition, I'm anti-vax because I'm resistant to mandates on vaccination. So that makes me an anti-vaxxer, even though I've had my body weight in vaccines, over the course of my life. So whatever. I mean, it is what it is. But I think when we were talking last time, I was probably at that phase where I was at this really frustrated phase because I realized politics get involved. I realized that money's involved. I realized that egos are involved. That's just the human condition, right? You can't get away from that. But there were medically unethical things, not only being okay, but essentially being mandated, right? I mean, they're telling doctors, basically throw away everything that you've known or learned up until now, and give people this vaccine, encourage people to get this vaccine, whether or not they have any symptoms, whether or not they have any risk of any significant risk of disease, right? So, and that was confusing to me, right? Because I'm like, we've gone beyond a money grab here. Like we have gone to amoral, unethical behavior being mandated.
Can you explain?
I mean, we're getting into like Nuremberg. Yeah, we're getting into like Nuremberg kind of category there, right? So suppose you came to me and you said, "Hey, Kirk, my great grandfather had testicular cancer, and I just want to make sure that I don't get that." And I said, "All right, well, let's castrate you. Let's take your testicles off." I mean, if you were dumb enough to do that, you would very easily be able to sue me for, whatever my malpractice would pay. And I could probably go to jail for it, because that's amoral. It's unethical. Right. If a little kid comes to my office and a little girl comes to my office and her mother or her grandmother had breast cancer and her mother has the BRCA1 gene. And I said, you know what, let's start treating her with chemotherapy right now.
Oh my God.
It's amoral, unethical, but tell me how that's different than giving a kid a vaccine for a virus that a kid has essentially a zero risk of having serious disease from, right? COVID doesn't affect kids. It just doesn't. I mean, there's been a couple of hundred and there's serious comorbidities in these kids who have died from COVID. Things like leukemia, Like not small things. These are big comorbidities. And there's always a few rare exceptions here and there, right? But way fewer kids have died from COVID than the flu, right? We don't mandate flu vaccines on kids. We don't mandate mask wearing on kids for the flu. We don't mandate closing the schools or social distancing. So none of this was making sense to me. I'm like, this is amoral. If there's a risk to reward benefit for anything I do as a physician, anything I do for you has a risk. If I give you any pill, any medication, I don't care if it's an aspirin, I don't care if it's a vitamin, there's a risk to it. And we have to make sure that the potential reward outweighs the potential risk. And when kids have zero risk of the disease and you're mandating a vaccine on them, and when, essentially anyone healthy and under 65 has a very insignificant risk. I mean, yes, you can die from COVID. And if you want to get the vaccine, go ahead. I'm not saying that you shouldn't. I'm not telling people not to get it. I'm saying this medically unethical to tell those people that they should get it and to mandate it, because we don't have any evidence that that's true. And when you're doing risk calculations, right? And any good statistician can tell you this. When you're doing a risk evaluation of anything, whether it's an investment or a vaccine, and the risk is unknown, then the risk has to be calculated as infinite.
Oh, wow.
Which means that you better be really damn sure that there's a big reward on the other, that the reward is significant because it's competing with an infinite risk. As an example, the rotavirus vaccine, I think it was on the market and being given as just the standard protocol for kids at a certain age nationwide. They did 5 or 10 years of safety research on it before it went to the market.
Yeah.
And then like 5 or 10 years after that, they figured out that it was causing intussusception and killing kids.
Wow.
And so that had to be a serious, okay, man, we better reevaluate whether we want to do something different with this vaccine. Do we want to change the scheduling of it? Do we want to change the dosing of it? Do we want to change the vaccine? Do we want to change whether or not it's standard protocol? Do we want to look right? Like you need to reevaluate it because, okay, now we know that there's a risk of death with this disease, with this virus or with this vaccine. The problem again is everything we do has a risk. The vaccine, and they're withholding the information. The FDA just cleared Pfizer to release their safety data in 2076.
Oh, 55. So they actually I know they had applied, Kirk. I know 2 weeks ago they'd applied, but you're saying that's actually been let go, that it's going to take them, 50 years to release their safety data.
50 years before they have to release it.
Wow.
And now another thing, there are repurposed drugs that have proven efficacious. Ivermectin, no matter what the hell they say, it has proven to be helpful. And not only helpful, but there is probably the most profound example of any real data we've had was India, where there were 2 regions of India where one had essentially outlawed ivermectin and another had made it mandatory.
Right.
And the one who had outlawed it was just getting crushed by COVID, and the one that made it mandatory didn't have any significant COVID. And then the region that had outlawed it started using it, and they got rid of their big COVID surge. There's plenty of clinical data. Like we have bureaucrats making the calls over here and mandating and telling people what to do. And it's all completely illegal, right? Like we just had, President Biden just worked with OSHA to put in some kind of, so OSHA is like the organization that oversees employee safety. Right. So it's supposed to be protecting the employee from corporate malfeasance, right?
Yeah. Kirk, I just lost you a little bit there, just dropped out. So you're
Okay.
saying that they're going through OSHA, and here in Australia we have the occupational safety and health.
Right. Yeah. Same type of thing.
Yeah.
So, yeah, and again, it's meant to protect the employer responsible with safety precautions, cutting corners, for profit or whatever motives.
Yeah.
And now this administration is shifting it and telling the employer that they have to mandate that their employees get vaccinated,
Well, can I
whether or
pause
not
you
their
there?
employees.
Can I pause you there and unpack a little bit
Yeah.
for the people listening? It relates to exactly to that again. What's the current science of the efficacy of the virus? Because that relates to if it should be mandated. And what's the current death rate from that vaccine? Because you talked about risk and reward. And then what's the current
Right.
death rate of COVID-19? So there's three things: efficacy of the vaccine, that's not only a percentage, but also over time, the death rate of the vaccine, death extreme, obviously, and then the death rate of actual COVID-19. And then that will tie back into, you stated it was illegal. Can you talk to those things and we can
Yeah.
then pick back up?
Yeah. So here's what we know. So the mRNA vaccines, just Pfizer and Moderna. And by the way, Moderna went public as a company 1 year before COVID-19, and they've never developed a vaccine before.
Yes.
So it's interesting that they get the contract for it. But aside, throw that aside. So Pfizer and Moderna have the mRNA vaccine, and what that is, it takes a little bit of messenger RNA. So messenger RNA is just a little bit of code. So when you read the DNA, it's like if you copied out of a book and you hand wrote a passage out of a book onto a piece of paper, whatever you hand wrote, that would be messenger RNA.
Okay.
And then that goes through these organelles in our cells called ribosomes, and it gets translated into a protein. So it changes what the cell does. And so any cell in our body, the way a virus works is a virus gets into our cell and it puts its mRNA into our cells, and it takes over our machinery, and it makes our cells, whatever the cell is, a liver cell, a kidney cell, a bone cell, nerve cell, doesn't matter. It takes over that cell, and it makes that cell make more virus instead of doing whatever it does. Liver cell functions, quit doing liver things, and it just starts making virus. And it makes so many viruses that the cell literally ruptures. And then it bursts out into the interstitium, and it gets in intracellular fluids, and it gets into other cells, and it gets in the bloodstream, and it gets into other cells. And the goal of the virus is just to make as many copies of itself as possible. And then you have it in your breath, and you have it in your, in your sputum, and your saliva, and your urine, and your feces. Like, who knows? Like, depending on the virus, it can come out all sorts of ways. And the goal of the virus, and that's a little bit of anthropomorphism, but we can say that just as a way to talk about it. But sort of the goal of the virus is to get as many copies of itself possible made, to spread itself around, right?
Mm-hmm.
Right. Just like we want to reproduce, just like every other animal wants to reproduce. And viruses aren't technically alive, but they want to reproduce and have as many of them as possible. So all that the vaccine is a very small piece of that messenger RNA. And all it does is it codes for the spike protein. And the spike protein is the little mechanism in which this particular virus is getting into our cells. The spike attaches itself to a receptor on the cell, and then it gets pulled into the cell. And that spike protein is almost certainly man-made by all the geneticists who've looked at this, all the virologists, who've looked at this, who are reputable, who you can't trace back to having some sort of unethical connection to the truth, right? They're all saying, hey, there's this gene sequence in there that doesn't exist in nature. So this spike protein was almost certainly made in a lab. And all we're doing now is we're injecting somebody's muscle cells, and we're saying we want these muscle cells to make a ton of this spike protein. And when it does, the immune system will make antibodies to that spike protein. And now, if you get the virus, as soon as the virus gets into your system, the antibodies will see that spike protein and they'll attach themselves. Now, antibodies don't do anything to a virus. They don't kill a virus. All they do, that Kojak light that cops throw on top of their car that sticks on there. That's how I describe an antibody, right? You just run around, you're sticking these red lights on there and you're telling the immune system, hey, go get all those red lights, right? I'm just marking them, right? It's like us lasing a target, right? We're just like, boop, that's it. That's where you're going. So the immune system is now going to attack what the antibodies are labeling. So that's all we're doing with the vaccine. That's it. So it's a partial infection because all you're developing antibodies to is just the spike protein. Now, when you get the actual virus, there are all sorts of structures on the virus shell. Like there's all sorts of proteins on the structure, and then the shell itself, and then, there, even the mRNA itself, like you can develop antibodies to all sorts of aspects of that virus. And if you get COVID, if you contract COVID and, your body replicates it enough, when your immune system builds a response to it, it builds antibodies to 24 different, we know of at least 24 antibodies that are being produced. So you're getting 1/24 of that. Now, the other thing is you're not fighting off the infection. When you actually fight off the infection, if you get COVID, if you get the vaccine, you're not fighting off an infection. You're just developing antibodies. That's it.
Right.
If you actually get the virus, now you're going to have antibodies. Those antibodies are going to mark the cells. Now you're going to have T cells and B cells come and attack this virus and kill the virus and tear it up, eat it up. Macrophages are just going to, natural killer cells are just going to munch it, tear it to pieces. And then the B cells have memory, and those are made in your bone marrow. And now for the rest of your life, you're going to make bone marrow white blood cells that can recognize COVID. So
that's why somebody had COVID has is it 7 times stronger or 6 times stronger?
Yeah. So what I was just about to say is the most robust, most complete, and most salient data in my mind around this comparison was from Israel. So Israel is the most vaccinated country in the world, and they had a big surge. They were really fast. They're a wealthy country. They threw down the cash. They got Pfizer for everybody, and they mandated it, and they got it done. They were way ahead of everybody. So not only did they have a high vaccination rate, they got it done really early. So I think within like 2 months of the vaccine coming out, 90% of their population was vaccinated. So they just had a big surge, a few months back. And their surge was actually higher than their pre-vaccine surge. So, every country's had at least a couple of surges now. And so they had a higher surge, and their hospitalizations were 49% of the people in the hospital they were calling unvaccinated. Now, unvaccinated could be one shot. If you didn't have both shots, you were considered unvaccinated.
Okay.
And people who had no shot. So 1 shot or 0 shot, that was unvaccinated. That was 49%. 50% were vaccinated, and 1% were people who had COVID before. Okay.
Wow.
None of the people who had COVID before who got hospitalized died. So there was a zero death rate from that. Yep. So what their data showed was that you were 27 times less likely to get symptomatic COVID if you had COVID before versus somebody who had the vaccine. And you were 7 times less likely to be hospitalized if you had had COVID before than somebody who had just had the vaccine. So it's more protective, and that shouldn't be a surprise to anybody. Natural immunity is a thing. It's not a theory. It's how we evolved. It's how we existed. It's how we've gotten 3 million years down the road. It's how all of this happened prior to a couple of hundred years ago when penicillin was invented, right? It's like we've gone like 99.9999999% of human history, we haven't had vaccines and antibiotics, right? We haven't had treatments, and we've survived with a natural immune system. So we have something called acquired immunity, which is if I get COVID, which I've had COVID, I get sick, my immune system figures out how to fight it. It fights it off. And now I'm exceedingly unlikely to get COVID again. And I'm even less likely to get really sick if I do get it. And I'm almost zero risk of dying if I do get it. And I was almost zero risk of dying before because I'm only 50 years old and I'm a healthy guy. I don't have any comorbidities. So for me to get a vaccine, you have to show your work on that. Like, you're going to have to give me one reason why I should have that. Right now, kids, we're talking about just their innate immunity. So when your kids are born, they're born with part of your immune system and part of your wife's immune system. Right. So they have some of your natural, right? They have some of your B cells and some of your T cells and some of your antibodies and some of your wife's antibodies. And so they've got this, right? They've got it in them already. So these kids are having it's such a small thing for them that their B cell, T cell immunity are killing it so fast they aren't even developing antibodies to it because they just aren't getting sick from it. And we've just approved it for 5 to 12-year-olds. So we're now recommending everybody in America over 5 years old to get the vaccine. And we know that there's a significant risk factor to it. Now, we don't know the real data because that's the type of data that we don't get. Pfizer, in the first 2 months of their own research, had 186,000 adverse events, right? And that was a small research. I mean, it was only a few million people. So that's a big chunk. And that's their data. And now we have this VAERS system over here, which is designed for healthcare providers. Now, here's how this works. I'm working as a healthcare provider. Somebody comes in to see me, regardless of what their complaint is. If at some point it occurs to me, hey, maybe I should test this guy for COVID, and I test him for COVID, and he has COVID, I just totally screwed that up.
Yeah, sorry.
If I give somebody the vaccine, if I'm working in a clinic and somebody had a vaccine, and then they come in to see me for whatever purpose, within the next 14 days of getting that vaccine, and I have any reason to believe that it could be associated with that, now it's up to me. It's up to my discretion as a healthcare worker who probably has to see 26 patients a day and has about 15 minutes per patient to figure out if I'm so certain that this is associated to their vaccine, that I'm going to go into the computer and I'm going to log onto this website and I'm going to spend 30 minutes filling out this form to report this adverse reaction. And then the CDC, who, by the way, is a partial owner of the vaccine patent, the CDC is then going to evaluate whether or not they think that my VAERS report is valid or not at some point in the future, which could be 2 days or 27 years. I don't know. So the VAERS system, we know, is ridiculously underreported. Most of the estimates are somewhere around 5%. I've seen it as low as 1%. So
underreported by 95 to 99%. Underreported.
Yeah. So let's be really generous and say 90% aren't getting through, right? So 90% of the adverse reactions. Now, the other thing is, when you do a safety trial for anything, or when you do a trial for any drug, when you do a randomized, right, placebo-controlled that whole RCT, that whole design, the placebo is the control group that you compare the treated group to forever, right? So you need to maintain the placebo group. But
Oh,
as soon as they said, okay, we're going to give the emergency use authorization, they vaccinated the placebo group.
oh
So we
no.
don't have a control group anymore. So we will never know the safety data. Never. It is not possible to get the safety data at this point. So now all we can rely on is these, are these incident reports getting through and getting attention. Now, as I said, it is so slimy. The connections between the pharmaceutical industry and the government. If you look at the boards of these, if you look at the employees of these, it's like a revolving door between working for the FDA and working for a pharmaceutical company. It's like, they keep like they go from being the CEO of a pharmaceutical company to working from the FDA, and working from the FDA to going to run pharmaceutical companies. I mean, it's this most incestuous thing. About 75% of the FDA's budget comes from the pharmaceutical companies. So it's a really untrustworthy thing. And we know that in 2015, Pfizer applied for a patent on a COVID vaccine, and they never sent in the sequence of the COVID vaccine that they were patenting, but it finally got approved a year before the COVID pandemic, and the NIH, right? So the NIH is who funds the research, like 90, well, not 90, but a lot, the vast majority of the research, of the really credible research, and what makes careers is NIH funding. Now, NIH now has a deal with the government, which is redundant because they are an arm of the government, to where when they fund research and it results in a patent, the NIH owns the patent. So now we have paid the pharmaceutical industry to design a vaccine. The taxpayers paid for that. Essentially, we gave them the money to do the research and develop it. And now they're charging the US government for it. And of course, the government doesn't produce money. They only get money from taxpayers. So now we're paying the government to pay the pharmaceutical company money for the research that we paid for. And the government, the NIH itself, is a 50% owner of the patent. So they're getting 50% of the money.
So NIH is going to start.
And they're the same ones. They're the same ones that are mandating the vaccine. They're the same ones who are saying everybody has to have it.
Yeah.
So there's a big conflict of interest in that. If I said, hey, you know what, everybody in the world needs sleep, and I'm the president of the United States, everybody in the world needs to take Doc Parsley sleep remedy, everybody would kind of see that as transparent, but that's what's going on. And this is not conspiratorial bullshit. I mean, I know everybody wants to call everybody names and call everything political. I was not at all political before any of this started. The only reason any of this became political to me is because the virus got politicized somehow. I was interested in the science of the virus and how to protect myself and my patients, my clients, my family. I wanted to learn as much as I could. And I started looking at the newspapers and the media, and I'm like, everything they're saying is wrong. Everything that they're saying is a lie. Like, this is absolutely false. This goes against everything that I know as a doctor. And one of the major things is that you do not treat somebody for something they don't have a risk for, especially when you don't know the risk of the treatment that you're giving. That is completely unethical. And the other thing is, this is still not an FDA approved treatment. They gave it emergency use authorization. And the speculation is that the reason that they're poo-pooing all of these treatments like ivermectin and hydroxychloroquine and Medrol dose packing and even aspirin and all these things that have monoclonal antibodies, all these things that we know are saving lives and keeping people out of the hospitals. there's clinical data where they're showing that 80% of the people, it reduces hospitalization by 80% to give people ivermectin. And that's not a small thing, right? Because if they're not going to the hospital, they're definitely not dying.
Yeah.
So what are we doing to the death rate? At least 80% lower, but probably much better than that, probably on par with the vaccine. Now, the other thing with the vaccine, like I said, it's a partial infection, which leads to a partial immunity. And if the spike protein mutates, your immunity is essentially gone, because that's the only thing you have an antibody to. And that's what this Omicron thing is that they're talking about. Omicron, however you say it. This new variant has, I don't know, I think half a dozen mutations to the spike protein. So will this vaccine do anything? I mean,
so with Kirk, with you said, just to keep it clear, because for the people listening, you went into this trying to find out from the science how to protect yourself from, and your patients and your family from COVID. That's how you started your research. Apolitical.
Yeah.
Now you've found out some other things. Can I ask you a pointed question? Do we have to protect some people from the vaccine? And if so, how do we do that? That's going to be a bigger question. I'm sorry to pause you there, but I think it's relevant now. That's why we're having a conversation in the current state of affairs. Do you, as a medical doctor, now think we have to protect some people from the vaccine, given the risk reward?
We need to protect some people from the government mandating the vaccine.
Thank you.
The vaccine should have never been given to everybody anyway. Any intelligent epidemiologist or virologist would tell you would protect the at-risk population. That's largely the elderly. I mean, almost exclusively the elderly, right? The median age of death from COVID in the United States is 4 years older than the median age of death in America.
Wow.
Right. So these are all people who are past their life expectancy. There's a large percentage of it. And I'm not dismissing that. I'm not saying that it's inconsequential that these people are dying. I'm saying those are the people we needed to protect. So if you're like, say, I don't know, let's pick a number, you can look, if you look at the age stratified data, essentially without serious comorbidities, and I'm not talking about like, high blood pressure and being 30 pounds overweight. I'm talking about like real comorbidities. Like you truly have some sort of disease going on that you're being treated for on a regular basis, or should be treated for on a regular basis. Without comorbidities, your risk of death from COVID under 65 is less than the flu. We don't mandate vaccines for the flu because there's a lot of adverse reactions to the flu vaccination. And lots of people, about half the people who die from the flu every year are vaccinated. So it's, the risk to reward your ratio doesn't pay off. So we don't do it. So what we should have done from the very beginning is say, okay, everybody over this age group, we highly, highly recommend you do this. If you don't, like if you're afraid of it or whatever, that's your business, but just know that you're in that really high risk. Everybody else, go out and live your life. Right now, there are other people, right? So there are people who are immune compromised, and again, people with comorbidities. Like, so all of the at-risk population, we protect all of them. Everybody else, go out and live your life and get COVID. When you get COVID, that is actually a sterilizing immunity, right? So you've probably heard this term about the leaky vaccine. What does the leaky vaccine mean? The leaky vaccine means that you can still get COVID and you can still pass COVID on to other people. Right? It's leaking, like it's protecting. It seems to be decoupling death, where your risk of death is much lower if you've gotten the vaccine, but you're still getting the virus. You're still able to contract it. It's still able to replicate, and you're still able to spread it to other people. If you had just had the vaccine, if you get COVID, and you recover from COVID, you're 99.8% protected from getting COVID again or passing it on to anybody. That's how you reach herd immunity. Now, herd immunity was a fantasy a long time ago. Cat's out of the bag. That's not happening. There's no way we're getting herd immunity now. This is a worldwide virus. It's worldwide mutation. We're using the same vaccines worldwide. This is a new endemic virus. If you look back in my Instagram videos, one of the first Instagram videos I did, like the first 30 days of this pandemic, I did a COVID video every day, because I was essentially going to the headlines of the news, taking the 3 top headlines and saying, this is how they're lying to you, or this is how they're misleading you, or this is what they're not telling you, or this is what doesn't make sense. And I was throwing these out every day. One of the, shit, I forgot what I was talking about.
No, it's okay.
I lost my train of thought.
Kirk, and I do that all the time as well. Can I hopefully I put this across in a respectful way? There's many people more qualified than you that spoke to about what you've just done. You've spoken for 40 minutes on generalization about vaccines, generalization about COVID. So let's now take that hat off. You've done it very, very well, but people have heard that before. I'm trying to get people to hear something they haven't. So I'm going to do 2 things with you. One, I'm going to paint the picture of you as a doctor with a patient, because you stated it was illegal. And I'm going to paint a picture of you as a special forces hat on. So here's the picture. A 20-year-old male or female sits down in your office, your clinic, you as a general practitioner, we say over here, a family doctor over there. 20-year-old, nothing wrong with them, normal, healthy person. The government, whatever country you're in, has mandated that they must get the vaccine to keep their job. That's why I'm wearing this shirt today. And they've said to you, Kirk, or Doc, informed consent, I feel a bit uneasy about this vaccine, but I have to get it to keep my job. You as a doctor, do you give them that jab? Given all you know about legalities, about moral, but more importantly, you as a doctor, what you're supposed to do, do you give them that injection?
No, I wouldn't.
And why?
Now, if I were a plastic surgeon and somebody came to me and wanted some procedure that I just thought was outlandish and irresponsible, and I wouldn't want to attach my name to it, I would just recommend that they go see someone else, right? And that's what I would do in this situation, because I would say, me sitting here looking at your risk of having any serious issues from COVID is literally, like, if you're a healthy 20-year-old, you are literally more likely to die from getting struck by lightning than you are COVID. Now, I'm not treating you. I'm not telling you to go live your life to protect yourself from getting struck by lightning. Why? Because it's a ridiculously low risk. It's even lower for COVID. So why am I going to give you a vaccine? I'm going to put a chemical in you that I don't know the safety data to. Nobody does. And I'm not saying it's unsafe. I'm saying we don't know. So if I don't know, why am I going to do it? Why? Like, tell me, what's the benefit of me taking the risk? So I don't feel good about that, because you're 20 years old and you're young and you're impressionable and you don't know as much as I do. Medically, you don't have my wisdom of, I've got 31 years of wisdom on you. I've got medical education on you. I've got clinical practice on you. I don't feel comfortable giving you that, because 10, 15 years from now, if this has some serious adverse effect to you and you come back to my office and you look at me and you're like, man, why'd you do that? You could have saved me from this with just, right.
Yeah.
I mean, I couldn't do it. And I think it's immoral. And I think any bioethicist would say that it's immoral if they didn't have the thumb on them from the NIH. The problem is the NIH controls all the funding. I don't know if you know this, but one of Fauci's, one of his closest colleagues suggested that this virus was manually manipulated very early on. I mean, like a month into this, and they had a bunch of emergency meetings, and then after the emergency meeting, this guy recanted and said, "Oh no, it's obviously a natural evolution." And then he got literally 10 times more NIH funding than he's ever had in his entire life immediately thereafter.
I knew the former Kirk, but I didn't know the latter on that, and that's incredibly telling. Look,
yeah,
you've painted the picture.
So
of,
I mean,
you painted the picture of the of the patient, and that's very telling again, and it's logical. But now, I mean, yes, I know where you're going with the big picture stuff, but now let's look at the special forces guy. We've been to places, we've seen and done things that other people haven't. Let's take the medical hat off. You're not a doctor. Now you're an SF guy looking at what's going around the world, and you see doctors doing that injection. They didn't do what you did, the guy with the stones to say no. Now you see the government's forcing that. Now let's put that hat on. That's, I think you used the word tyranny somewhere along the line. What are your thoughts as a special forces guy for the population with a politicized agenda on a medical mandate? Let's call it a medical mandate, because if they can, in my opinion, if they can do an injection medically mandated, they can also castrate you because it's just a medical intervention. So let's put that hat on, Kirk, and nobody's talked to this.
Yeah, I mean, where does it stop? I mean, if you allow any of that, it is medically tyranny. It is medical tyranny, right? And it's only loosely medical. I mean, people are going to frickin' drugstores and getting this injection by somebody who doesn't know their ass from a hot rock, just some 18-year-old who's been taught to like stick a needle in somebody's arm. They're not giving informed consent, by the way. So as a doctor, anytime somebody comes in my office and I'm going to do a procedure on them, I have to list every possibility. I have to say, here are all the possible things that could go wrong. One of those things is death. They aren't even doing that, right? So, but to get back to your point, if I can say you have to wear a mask, if I can say you have to stand this far apart from people, if I can say, well, you have to stay home on these days, you can't go to work, if I can say you have to take this injection, where does that stop? Why can't I say you have to eat this, you have to not eat that? You can't eat beef anymore. Nope, that's bad. You need to eat tofu, and you can't go to work today because climate change, it's getting bad out there and we don't need your car on the road. So where does it stop? Right? My country, this country here, it wasn't founded on capitalism. It wasn't founded on religion. It was founded on freedom of religion, and freedom to go pursue capitalism, and freedom to do whatever the hell you want to. That's you cannot pursue your life without freedom, and you can't have freedom without privacy, right? If somebody can listen to everything that you say, if somebody knows every shot you've gotten, if somebody knows everything about you medically, somebody knows where you're going, where you've been, what you're thinking, how much money's in your bank account, what freedom do you have? You don't have any freedom. You don't have any autonomy. There is no point to your life. You have become a cog in the wheel. You're a cog in the machine. You're just a cog in the machine, and somebody up there is cracking the whip and cranking it. You are useless. There's no point to your life, in my opinion. So I consider this no different than, like you say, castration or rape, right? Rape, I mean, any penetration, no matter how slight, constitutes the act. I mean, yeah, it's a really little prick, but it's still a prick. They're shoving something into you that you don't want into you. And they're telling you, oh, it's not mandatory. You just won't be able to participate in society if you don't do it. Sorry, man, I'm not going to be part of that society. That's That's why I live in Texas. You know, we're not doing any of that crap down here. And if I can never get on another plane and go anywhere again, then that's just the way it is. I don't care. I don't, you know, people say it's a small thing. Take the mask. I mean, the mask seems insignificant, right? It's just a piece of cloth. Why is it significant to have to wear a mask if you don't want to wear a mask? It's just a piece of cloth. What's the big deal? It's making other people feel good, like whatever. It's, you're not tugging the tail on the tiger. Well, here's why. Because you have a set of beliefs, and you've developed them over the course of your life. And a lot of them come from influences in your life, like your parents or religion, other family members, teachers, coaches. You have a set of beliefs, and there are certain things in the world that you believe are true. And because of those beliefs, you act in a certain way, and you think in a certain way, and you value certain things. Now, if I say you have to wear a mask, whether or not you believe it's true that you need to wear a mask, I've just said that my control over you as a government is more important than your personal beliefs. So if your personal beliefs are not as important as my judgment as your authoritarian, as your government official, again, what is the purpose of your life other than to do what I'm telling you to do? And so while the mask seems insignificant, it's a starting point. It's a slippery slope. You just keep adding little things on it. Tyranny never happens all at once. They don't just, you know, the Nazis didn't just jump up one day and say, everybody's a Jew-hating Nazi now, we're going to kill all the Jews. Like, it didn't work that way. It's a slow progression, little bits at a time. And that, you know, and I know everybody hates those metaphors, but it's, everybody's so damn ignorant of history. It's one of the few things you can talk about that people understand. It's
boiling the frog, isn't it, Kirk?
It is.
People that haven't heard that term, you know, how do you boil a frog? And a live frog, you throw it in boiling water, it's going to jump out. But if you put it in water, it's happy, and then just turn the temperature up. What you're saying, Kirk, and again for the audience, because I know you and I talk about it, I always try and paint it back for them. It's 2021, almost the end. It's almost 2022. This has been 2 years, almost, I think 18 months, 19 months.
Yeah.
Look at what's, I'm not speaking to you because we're preaching to the choir, but people, look at what's happened from day one to now, and what freedoms, as Kirk has said, we've lost. You know, it's blowing my mind.
And so in my country, here are the things that stand out the most, right? So the medical ethics that we've talked about, right? That blows my mind.
Yeah. Because
2 years ago, I would lose my medical license and probably be thrown in jail for what they're telling me I have to do now, right? Like, that's a mind scramble. It's 180 degrees from everything I've been taught, and every other physician knows it. And a lot of people are willing to say it, but we just get censored and banned. I mean, I got kicked off Twitter over a year ago. Nobody said why. Like, it's just gone. Like, you know, so that, like, there's that part. I mean, so, you know, call that medical tyranny, or demoralization of medicine. I don't know. But then there's two more factors. We politicized it. And in our country, you know, we'll just call it the right and the left, conservative, liberals. I think they actually mean opposite things in your country. But, you know, so we have our left and our right. Our left controls most of the institutions of the country, right? The Hollywood, educational system, the media, they're very left. The right, the conservatives, Christians, patriots, military guys, just want to, you know, get married, have a kid, have a wife, house, white picket fence, earn a living, have some grandkids, you know, take care of myself, be my own man, you know, make a life for myself. Different ways of seeing the world. Not saying which one is right or is correct or incorrect, But when you do the research on the left and you say, what do you think your odds are of dying if you contract COVID? People on the left literally think their risk of dying is around 60 to 70%. Like a 30-year-old, a 35-year-old will tell you 60 to 70% chance of I'll die if I get COVID. It's like a 0.003% or something, right? Like couldn't be farther off the line. How many, I don't know, how many people, any of that data, the point is that's so far off because they've instituted a fear campaign. And the fear campaign is how you control people. And the media in our country is a arm of the Democratic Party. And the Democrats are in charge right now. And they're the ones saying mask mandates and lockdowns and vaccines and all this stuff. And the media is telling them, giving them all the reasons why that's true and why you should do it. And they believe it. And I'm not saying they're dumb. It's just that's the following they grew up under, right? So that's like their religion, for lack of a better word. Yeah, but that's what they follow. And this
you use the word religion, but it's their belief. Yes.
It's their beliefs, and this is the belief structure that they trust. They're trusting academia, they're trusting the bureaucrats, they're trusting the government, they're trusting the pharmaceutical industry, who they all hated it until like 2 years ago. So I don't know how that happened. And they're trusting the science, which is a whole nother bag of worms I go on an hour about. So that's one thing. Now, the other part of it is you constantly see, and it just happened literally 2 days ago, you constantly see the dictatorial politicians who are telling everyone to wear a mask and vaccinate and social distance and have kids wear masks during Thanksgiving and don't let the kids eat near the adults who are unvaccinated, like all this ridiculous crap that no one would ever do. And then there's a video of Joe Biden inside of a store shopping, glad handing, talking to people, whatever. Everyone in the store has on a mask except him. He's 80 years old. All right. You see that. You've seen it with Governor Newsom. You've seen it with Nancy Pelosi. You've seen it over and over again. And I'm not bitching about the hypocrisy. Everybody's a hypocrite, right? As soon as you have standards, you're a hypocrite, and politicians are the worst hypocrites. And we know that. So big deal, hypocritical. The thing to think about, the thing to remember, what should be poignant about that is that they don't believe what they're telling you.
Thank you. That's perfect.
If they believed you needed the mask, they would be wearing the mask. They're not wearing the mask because they know it's bullshit. They know they're bullshitting you. And they're proving it to you by not wearing the mask. They're proving it to you by putting on the mask to take photos and then taking off the mask and going back to what they're doing, which we have videos of them doing that, like 50 of them at a time doing that, because they know it's bullshit. And I don't know if you've heard of Project Veritas over here.
Oh yeah,
like an undercover news agency. So they got in with a CNN producer, and they talked about all these deliberate manipulations that they had done to the information that everybody was seeing and what they were doing next. And they admitted the next thing they're going to do is climate change. And this was like 8 months ago, 9 months ago. And now what's the big deal? Climate change. And that's the next fear factor. And then that fear factor is going to give them a little more control. And the other thing to remember, whether it's masks or vaccines or social distancing or lockdowns or vaccine passports, every time the government gains a little bit of power, they hold on to it forever. They never give it back. Doesn't matter if it comes during an emergency. Like we have the Patriot Act over here because of 9/11. Well, the Patriot Act now allows the US government to spy on every American anytime they want to, for whatever reason they want to, because it just happened to work out that way. And it's being used, so
let's
I know I'm starting to rant like a conspiracy theorist.
No, I'm going to pull it together for you, buddy.
Everything I'm saying is verifiable. You can look it all up. Don't trust me on it. Like you can go find data to say exactly what I'm telling you.
You're exactly right. You and I have not spoken about this, and you're saying the exact things, but from the same sources, but with a little bit more information. Again, I'll tie it in a bow a little bit. Hitler was known to have said, "Tell a lie big enough and everyone will believe it." Going back to what you said about, 50 politicians taking off their masks. You mentioned something there about the left and the right. When we, as special forces operators and strategists, looked at a country, the resistance fighters, they were the ones we actually looked at, that tiny pool of people. They were the ones that we historically go in and help, correct?
Right.
Look at France in World War II. I say that because I sat next to this amazing woman called the Mouse. She was like 75 years old. She's taught more Nazis than you've probably had hot dinners. It was an amazing woman. And her job was to go and parachute into France, go and find the resistance to the occupation and help them out. You've painted a picture, and if people are listening and thinking conspiracy theory, our jobs were to go in and help those, I can't say good or bad, but they were against the tyranny, because we saw them as tyrannical governments, and help them win, wasn't it?
Yeah. Well, I think I think it's a valid assumption that anyone who is, whichever side is censoring is the bad guy.
Yep. That's
right.
a very, very clever thing to say.
And right. I mean, so in our country, we have one side, that's associated with legacy media, academia, bureaucrats, social media, the tech industry. They're all aligned. And they're the ones who are saying, you can't say that. And if you say that, we're taking you off. You can't do that. If you do that, we're firing you. If you don't do that, we're firing you. You're going to lose your job. You're going to lose your livelihood. You're going to lose your ability to speak. You're going to lose your ability to have your own children. I mean, I saw in Australia, they took someone's child because the parents weren't vaccinated or something. And they went in the house and
I can't speak to that one, but what I can speak to is the army last week, or the military used to take, and this was by the premier of the state, kind of like your governor. 38 people were taken by the Australian military. They were either tested COVID positive or close contacts. One of them was actually fully vaccinated, and they were taken and put in a quarantine camp. That's where we are now. A rhetorical question is, to concur with what you're saying, is when in the history of ever has someone that's done, a government that's done those things you say, censoring, saying you must do this, you can't work without this, all those things, when in the history of ever have they been the good guys? But my question to finish this off, Kirk, is how do we protect our children's health and wellness? Because you did state in the middle of this, the risk is zero, and I think the risk of pericarditis is 1 in 26,000. How do we protect our children's health and wellness from this medical and government tyranny? What do you see, given those two hats? Big picture.
Yeah, well, I mean, so over here, I mean, the benefit of having a republic is that, we have 20-ish, 21, 22 states that are standing up against the tyranny of the federal government and just saying there won't be any vaccine mandates in this state, and there won't be vaccine mandates in the schools, and there won't be mask mandates in the schools. And so, but that aside, I mean, I don't know exactly what the pressure points are over there, but over here, it's just about public education, right? So, over here, what most of people like me who are called by the left COVIDiots, people on my side of the aisle, by and large, they're just taking their kids out of school systems. So they're either putting them in a private school or they're homeschooling them, and getting collectives of homeschoolers because that's the only pressure they have on them. I think I think that the masks are probably going to prove to be at least as detrimental as the vaccine.
Yep.
Probably more. I mean, I think it's going to not, I mean, not only is it going to interfere with really young kids learning, right? I mean, because you think about how much we pick up non-verbally, right? And how much communication, facial expression, and all that's being lost. And, you know, learning to read in school, and like all sorts of things, understanding expressions as being, confused or friendly, or
exactly the basics,
or like whatever. I mean, there's all sorts of impact there, but there's also this message that, that the world's an inherently unsafe place, so unsafe that you have to do something uncomfortable, like restrict your breathing with this piece of paper that everybody knows isn't pleasant. I mean, it's not like anybody enjoys wearing a mask, and you don't enjoy it because it's restrictive, right? And so the world is so dangerous that you have to put this restriction on yourself. And there's these things called viruses that just float around, and if you don't have a mask on, they could just, go in your mouth and you'll die from them. So what type? And we already have an overly anxious population. Kids on Xanax and so forth over here. I mean, that's almost the norm. I want to say like 40% of high school age kids are on like some sort of anxiolytic now. Wow. And like 60% of them are on some sort of stimulant for ADHD, or and I mean it's only going to get worse. I mean, you're perpetuating a fear-based culture, and there's the obvious just sort of bad feeling about that. Like, it just doesn't feel good to walk around under fear. Yeah. But we also know that, the physiologic changes associated with fear are catabolic. They're detrimental to you. And one of the most obvious things that happens with excess stress hormones, cortisol, epinephrine, norepinephrine, when those increase, is the prefrontal cortex decreases in activity, because the closer you get to fight or flight, the more impulsive you want to be, because the impulsivity is pure reactivity. You don't want to think yourself out of a fight or think your way through a fight. You want to actually, you want to be super reactive and super impulsive and just go. Like, you want to be fast. So the prefrontal cortex in kids isn't fully formed until about 21-ish for women and 25-ish for men. So if you're running excess stress hormones, which we're already doing because of social media, because of sleep deprivation, because of processed foods, because of all sorts of crap that we do to society, we're already interfering with prefrontal cortex functioning. And that's essentially where your IQ is. That's the part of our brain that makes us the smartest animal on the planet. These masks are, I bet you anything that we see a statistically significant decrease in volume of the prefrontal cortex of kids who've grown up underneath this. Now, how durable will that be? How long lived will that be? Will we be able to recover past it? I don't know. It depends on how long they play this game. Right now, it seems infinite, that they're just going to keep being new variants and new reasons to lock down and wear masks and do different boosters. So, yeah, I mean, it's anybody's best guess at this point. But I think the mask and the social distancing, restriction of activity, restriction of movement, it's going to be at least as detrimental as the vaccine. And the vaccines could turn out to be great and have overall amazing safety. They're not amazingly effective at preventing COVID. They are effective at decreasing the risk of death of people who are at high risk. But again, we're treating society as though it's homogenous. It's not. If you look at the age stratification, it's very clear where the risk is. Young people aren't at a risk. There really is no risk to speak of. So how can you even measure the efficacy of, that's like longevity medicine. I have a lot of doctor friends who are into longevity medicine. I'm like, well, how does your client know if you helped them or not, right? If they die at 80, how do they know they weren't going to die at 80 if they never worked with you? Or, or maybe they would have lived to 90 if they didn't work with you. Maybe they would or maybe they would have died at 70. How does anybody know? And so you're kind of at that same thing. If you're giving me a vaccine and I don't die of COVID, well, no shit, I wasn't going to die of COVID anyway. So how do you prove that you did anything?
Yeah. I was thinking of a way to, I've never done a show like this. I really wanted to give you the platform to speak, and I was thinking a way to wrap this up positively, but you did it just then yourself. Thank you. I hope that as the listeners have heard you, Kirk, you presented just some basic facts, basic logic. You stated from both hats, as a doctor, as a special forces guy, but in particular, really powerful as a doctor, that 2 years ago, you would have gone to jail for some of the procedures that they're saying to do. Now, an interesting way out. I want to thank you for coming on. I appreciate you, your knowledge and your research. And if anybody's heard this and it's helped clear things up a little bit for them, great. You're very succinct in saying, the risk down here of mortality, fatality from COVID is none. And maybe it just helps people make some decisions. You threw some interesting things in there about homeschooling. Literally, I think tomorrow, half of this state has to be vaccinated or they lose their jobs. But that's literally going to be illegal, but the lawyers are going to be fighting that out. It's interesting times, man. I don't know where to go and where to sum it up, but I think you did it better than I did. I want to thank you for your time and being on the show.
Yeah, I appreciate the opportunity to chat with you about it and get an audience. And the other thing I'd like to point out, where I lost my train of thought earlier, was I compared this to COVID, the first SARS-CoV in the United States was 2007 and 2008.
Right.
And it just became endemic, right? So that just means that it became sort of part of our flu season. We have a season where respiratory illnesses are really common and people die from respiratory illnesses. And it's anywhere from 20,000 to 85,000 people a year, and depends on what respiratory illnesses are around, but it's just all kind of lumped under the flu.
Yeah.
This is going to be one of those things. And that's what I was saying about the vaccines, the leaky vaccines, the fact that we're using the same vaccines worldwide, the fact that it's been around this long already. So many people have gotten it. At least half of the people by the CDC's admission, at least half the people in America have already had the virus, right? So it's going to become endemic. And what people don't realize, one of the main games that the media plays when they're doing these fear campaigns is they don't give you a denominator, right? They just throw out this number, like, they could say something like, 100 deaths from this year or whatever, and you go, wow, 100, but maybe it's usually 10,000. You don't know, right? Like 100 compared to what, right? 100, right? Like, so what's the usual? And what people don't realize is that there are hundreds of thousands of viruses on the planet, right? Like, and so when we say that like half of your cells are your cells and half of your cells are bacterium, what we're really saying is they're microbial, and they could be viruses as well. So you have trillions of viruses in you right now. Like right now, you have trillions of viruses in you, and some of those are very helpful to you. Some of those are doing great things for you, and they're all over the planet. And they're so ubiquitous. You're not going to avoid them. It's like saying you're going to avoid air molecules. There's this estimation that if you took just the viruses in the ocean, there's something like 1 billion viruses in a liter of ocean water. If you took just those viruses, and to give you a scale, if you made a virus the size of a tennis ball, a human being would be 500 miles tall. Right. Wow. So that's how small these things are. If you took the viruses and just stacked them to end, they would go 10 billion light years. I mean, that's just the ocean, right? And so you think about these viruses are everywhere. You're not going to avoid viruses. You're not going to avoid exposure to this virus. be healthy, de-stress yourself, sleep well, eat well, exercise, be happy, live your life. Yes, there's a chance you could die from this virus. There's a chance you could get hit by a car. There's a chance you could get blown up in a terrorist attack. There's a chance you could have a heart attack. There's a chance of death no matter what. That's part of life. Don't let anybody fearmonger you into believing that this is any more dangerous than anything else. This is not a significant risk factor for 99.9% of the population.
I think there it is, man. That's the soundbite. That is the simple truth. And unfortunately, I think the governments around the world, it's almost like a little kid who tells a lie and they get stuck. And they gotta keep telling that lie, and gets bigger and bigger and bigger. Yeah.
Their egos are not going to let this go for a long time. I think the Roman Catholic Church took 350 years to admit they were wrong about Galileo.
Wow. Kirk, it's been great having you on. I really appreciate the just the logical way you've spoken to that, and the positive spin there. Literally, you've got a ray of light there at the end of, hang on a sec, just be real and live your life, because I know from all your teachings, cortisol depresses the immune system, and we got to be healthy, happy, and hopefully wise, which would be wise not to listen to what the media is telling us.
Yeah, I don't know how it is there, but it's just propaganda here. And I think most people are catching on to that.
I hope so, man. I hope so. Look, I'll wrap it up and we'll have a chat afterwards, but thank you so much for your time. It's been great to see you, and I hope people got something from this. Thank you very much.
I hope so too. Hope we didn't just blather on and waste everyone's time.
No, we're good, man. We're good. Thank you.